I'm Jill Angelo, host of the G-Spot. I speak with the most forward-thinking experts in the medical and wellness industries, all in an effort to bring awareness to women's hormonal and vaginal health. When we feel fabulous in our bodies, we are more confident, we have healthier relationships, and we have better sex. Here's to a happy, healthy vagina. I'm here today with Dr. Lucy Puryear, Medical Director of the Women's Place Center for Reproductive Psychiatry and the Co-Director of the Menopause Center at Texas Children's Pavilion for Women. In your words, why don't you tell us what you do?
I take care of women with mood and anxiety and emotional issues that are related to all sorts of reproductive events, and can be from menstrual sort of PMS kind of issues to issues during pregnancy, postpartum, around menopause, anything having to do with reproductive events. And in general, that means times in a woman's life when she's having hormonal changes. And, you know, in general, that's between the ages of about 16 and 50-ish. And, you know, anything from, you mentioned loss, you know, one of the things about having a baby is that, you know, it's a wonderful time, but it also has big hormonal events that go along with it. But sometimes pregnancies don't always turn out the way we hope. And so there's both hormonal issues that go along with being reproductive, but also stressors and losses and joys and challenges. So I kind of view myself as a woman's advocate. It's how I like to think about myself.
Your career has largely been about helping women emotionally and keeping them healthy that way. When it comes, you mentioned the hormonal change. You know, how did you get your start in the emotional side of women's health attached to hormones?
I actually, ever since I can remember, have been interested in women's health. My father's a physician, and so I always thought I would go into healthcare in some way. But when I was late adolescent, early 20s, and starting to visit gynecologists for my own healthcare, I remember feeling sort of very patronized. I can remember in particular, you know, speaking to a male physician about some PMS symptoms I was having, and he sort of patted me literally on the head and said, you know, they're there, it's okay. Every woman experiences that, and sort of moved on. And that was probably a pivotal moment in my life, because those symptoms were really causing me great distress. About a week before my period, I would, you know, get into arguments with my significant other. I would cry. It was not a pat on the head kind of moment for me. And I remember thinking, this was not the way I wanted to be treated, or women should be treated. So I went into medical school with the idea I was going to be an obstetrician gynecologist, and I had the fantasy that I was going to be the kind of OB-GYN that listened to women and paid attention to sort of all of their needs, both physical and emotional. But at the time when I was in medical school, there were no women OB-GYNs. It was a pretty male-dominated world, and pretty surgical, meaning there wasn't a lot of attention paid to women's mental health needs. And so I did my psychiatry rotation and sort of fell in love with it by accident. It was a place where you sat and listened to people's stories and felt like the interventions I could make in people's lives really made a difference, not only for them, but for their families and their grandchildren and their grandchildren's grandchildren. And so I chose psychiatry, and I guess while I was in psychiatry residency, I had the opportunity to go teach some OB-GYN residents about depression. And it occurred to me that I could take my love of women's health and really my love of, I was very interested in women's bodies and hormones and babies, and I could merge those two things. And it was back in the early, trying to remember, early 90s in the United States when women's mental health started to be a thing. It had been going on in England probably since the 1960s or 70s, but really had not made its way into the United States until the early 90s. And I thought, this is sort of the perfect blend for me of my interest in reproduction, women's physical health, women's hormonal health, and how that relates to their psychological and emotional health. And it's just been ever since then sort of a perfect place for me. And I think over the last several decades, there's been more and more awareness of how important it is paying attention to women's moods, women's emotional life, and how that is intimately linked into their hormonal status and how that's linked into their health in general and their family's health and their work health. And so anyway, that's a long version of how I got here.
Genev's mission is about taking on the taboos of women's hormonal health. And, you know, their psychology and their mental health is part of those taboos. Can you explain why you think it's still so taboo?
My answer is pretty complicated, but I think it's threefold. And it addresses three areas of continuing bias and stigma. There's still a I don't know what the right word is, but bias or stigma towards women. You know, the classic, we don't get paid as much as men for doing the same work. I mean, I think still in the United States, maybe all over the world still, women have not quite risen to the same level of importance or recognition that men have. So one, it's because it's a women's issue, and that tends to be marginalized. It's a mental health issue, so that's another big area that, for whatever reason, people are ashamed to talk about. There's still some notion that mental health is not a real illness, but it's a weakness or a failure of a person's character. You combine that with a woman and you get the sort of, then another stereotype about women is that, you know, we're too emotional or too moody or too whatever, too. And then I think anything having to do with sexuality and women's bodies and makes people uncomfortable. It's always fascinating to me how, you know, it's okay to put erectile dysfunction ads all over the television, but there's still a taboo about talking about women's sexuality. And I think there's still this sense that women don't need to be sexual, don't want to be sexual, don't have to be sexual, and that's really not something that's of major importance or major concern in the same way that I think men's sexual health needs have been addressed. So you put together women mental health and female bodies, and I think you've got three areas that are just hard for people to wrap their head around and to talk about.
Well, let's talk about sex then for a moment. You know, with your patients from a mental health perspective, what impact does it have on their sexual lives and their libido and their desire to have sex, and what kind of frustrations do you run into?
That's really interesting. I've sort of made it a mission I always ask women about sex, and every time I do, I get a, thank you for asking, because it still amazes me how many physicians don't ask women about their sex lives. Even their OBGYN or their internist or family doctor, women just don't get asked. So I always ask everyone, tell me about your sexual functioning, and, are you enjoying sex? Are you having physical problems with sex? I think sex for women is complicated. There's the emotional piece where women have to be feel safe. Women have to feel attached. For the most part, women need to feel connected, and these are some stereotypes, but tend to be more true than not. And so that women's brains have a large part to do with their women's brains are connected to women's sexual functioning. When women are depressed, there's one of the symptoms of depression is a loss of interest in sex. When women have small children and are doing caretaking, and women still tend to be the primary housekeeper, caretaker, child care person, the exhaustion that comes at the end of the day can certainly interfere with a desire for sex. And as hormones change, postpartum is a really interesting period where women will come complaining to me 6 months postpartum that, they don't want to have sex with their husbands, and their husbands are upset, and they're upset, and they feel broken. And, I ask them if they're breastfeeding, and a lot of them say yes. When you're breastfeeding, your estrogen levels are very, very low. And estrogen is part of healthy sex drive for women. Plus, when your estrogen levels are low, you have vaginal dryness. And vaginal dryness makes intercourse painful. And so not only do you have a lack of interest in sex, but if you attempt to have sex, it's painful. It sort of mimics what happens around menopause. So if you're a woman 32 years old with a 6-month-old baby, and nobody ever asks you how's your sex life, you start to feel, shame. You start to feel worried about your marriage. You and your husband may be starting to have conflict. It's one of those instances where just asking a woman about her sexual functioning can make a huge difference in somebody's life. And it's a simple question.
And what often is your kind of response if a woman does voice it, or if you've asked her and invited that conversation? What are you hearing, and then how are you responding to that in terms of making recommendations or just making her feel heard?
Right. I mean, I try and normalize. A lot of women's health issues get pathologized that I don't think need to be. Vaginal dryness is a good example. Menopause or postpartum, that's just normal physiology. It's not an illness. It's just normal. And, but because it's normal doesn't mean that it's not a problem. There are things you can do. So, I try and normalize the lack of desire because you're tired. I try and normalize the vaginal dryness because you're breastfeeding. I try and normalize, this is just a stage in your life, and these are common things that women experience. And then now that we take it outside the realm of there's something wrong with you or you're a bad person, let's talk about some strategies. And there's lots of strategies. I often recommend for postpartum women planning sex. Sex is going to happen every Saturday at 2 when the kids are in bed. And they look at me like I'm crazy because that doesn't sound very romantic or sexy, but you plan it. Your husband knows it's going to happen. You know it's going to happen. It takes the pressure off of, your partner going, how long's it been? It's been, 2 weeks. Is she forgotten? It takes the pressure off the woman of thinking, oh my gosh, I wonder what my partner's thinking. It's just like, okay, every Saturday at 2, we're going to put the kids to bed. And it becomes actually, when people come back and talk to me, they're like, that worked great. that made a huge difference. You know, it becomes part of the routine of taking care of yourself, taking care of your partner, taking care of the marriage. I recommend hotel sex a lot.
I love that. Any hotels in particular? No, I'm kidding.
It can be 20 minutes away from your house. It doesn't have to be overnight, although overnight is better. But, you know, getting away from children, being alone in a hotel room, not having to listen for somebody knocking on the door or a baby crying, or not having sex in the bedroom when there's a pile of laundry in the corner, all of a sudden makes life more interesting. So you'd be amazed at how many women don't know about lubricants. They actually are really helpful. I was treating a woman who had just gone through menopause and was not able to take hormone replacement because of a history of breast cancer. And she and her husband had stopped having sex because it was so painful because of vaginal dryness. And, you know, she was really distressed because that had been a really important part of their marriage. They both enjoyed being sexual. And, you know, I recommended a lubricant, and she came back, and it was sort of like miraculous that fixed the problem for them. And again, it's not, you know, that should be something that's just normally spoken about.
I love your suggestions around bringing a refresher to sex in a relationship and in a woman's life. Do you ever get to a point where you also talk to a woman's partner? Like, do you have couples come in, or is it usually between you and the female patient?
It's usually between me and the female patient, just because that's what our clinic is set up to do. I will tell you that, yes, I will, not often, but frequently have the partner come in, the husband come in, because I think it's helpful. Sometimes the woman feels a lot of shame around whatever issues she's having. And so hearing me explain to the husband or the partner, you know, this is what's going on, this is normal, these are the ways to solve this challenge, can be really, really helpful in giving the woman a voice and, again, normalizing what's happening. And not that men are bad people. You know, men often think they've done something wrong or it's them, and it's often not them. By speaking things out loud and making things public and heard and giving permission for women to speak, allows them to have a voice and allows them to speak to their partners about their needs and taking shame out of all of this. You know, it's kind of, when I ask people about sex, they sort of look at me like, you know, is it okay to talk about this? And I'm like, I talk about this every day. This is okay to talk about. And so I think bringing partners in and helps reduce the shame that women may feel about speaking about some of these issues. One of my favorite stories is a woman was coming in and complaining about sex life, and, you know, I didn't quite understand what the problem was, and her husband was in the waiting room, and I had him come in, and he had erectile dysfunction, but was too embarrassed to tell anybody and didn't want to go to the doctor. And I had to say to him, look, you know, 50% of men 50 years old need to take Viagra. So go to your doctor. He went to his doctor, and you know, they had sex again because the issue was actually him, not her.
You know, I assume you're talking to women of many different ages, obviously. Do you find that this comfort around sex and or the stigma is different with younger women in their early 30s or even late 20s compared to women in their 50s or 60s?
I really don't, and I find that surprising. I think, you know, that I think women in their early 20s and 30s are maybe more comfortable talking about things, but they're still not comfortable talking about themselves. So they can talk about the topic of sex, you know, and they can use words that maybe an older generation might be less comfortable saying out loud, you know, talking about sexual practices or sex words, But when it comes to talking about themselves, there's still a lot of embarrassment and shame.
Do you think women are taught to expect pleasure or desire pleasure, or do you see more obligation associated with sex and intimacy?
That's a great question. I think a lot of women want pleasure and expect pleasure. However, I also think a lot of women expect that if there's not pleasure there, that's okay, that's something that they're just supposed to tolerate or put up with. And that's such an interesting question, because I talk to lots of women who are having sex out of a sense of obligation and or desire to please their partner, or they love their partner, or and want the intimacy. But my question will be, but do you enjoy it? I mean, are you getting pleasure out of it? And they'll be like, no, but that's okay. And my next comment is, no, that's not okay. You're supposed to enjoy it, and if you don't, why not? And there are things you can do to make that better, whether it's pelvic floor physical therapy because you have some pain, or it's lubrication, or it's you need a different kind of foreplay to get aroused, or whatever it might be. So I think women want to experience pleasure, hope that they're going to experience pleasure, but if they don't, I don't think they're taught that it's okay to search it out and to fix it.
It's unfortunate, but I hear it from women we talk to for Genève, or I've heard it from other physicians and doctors, and it's kind of an issue to start with, almost, or it's something to start with even before I think we get to solutions. It seems to be the unspoken bigger kind of social issue to tackle.
Because I'll ask women, have you ever had an orgasm? And some women will be like, I'm not sure. And I'm like, well, how can you not be sure? To have the conversation about what that means, and that's supposed to happen. You're supposed to enjoy sex.
As a medical expert in a field that still has a lot of stigma, as well as, you mentioned earlier that the mental health side of women's health is still relatively new. What obstacles have you run into?
Not to beat an issue to death, but just stigma. And it's not just stigma, it's huge. The shame of saying you have a problem and that you have a mental health problem, that's probably the biggest hurdle, because people with mental health problems, it's getting better, but are made fun of, are some of the language that's used is pejorative. Just an everyday conversation, when people say, you're a psycho, you're nuts, you're crazy, you're bipolar, you're using it as a sort of casual label when they're actually, real illnesses that people suffer from. So there's all of that sort of societal stigma about having a mental health issue. The other problem is twofold. One, just mental health in general. There's not enough psychiatrists or therapists to treat mental health issues. Insurance does not adequately cover mental health care. And then there's not very many women physicians who in particular specialize in reproductive mental health. So, there's big cities tend to have, a couple of people maybe, but the vast majority of the country, there is not someone who understands the unique issues surrounding, hormonal changes, reproductive changes, and they're linked to mental health issues. And if you don't get that piece, if you're on the OBGYN side, you tend to, as my experience was, just sort of blow it off And if you're a psychiatrist without an understanding of the hormonal piece, you may blow off the physical piece as being a mental health issue, and they're linked. And often you have to approach both sides, the hormonal piece and the mental health piece, to get somebody well. And there's very few of me around.
You said there's only one of you to go around. How does that message about mental health and reproductive health start to get out there in your view? Like what do companies like Gennev need to do, or other players in the industry? What would you hope to happen?
When you have focus groups of women sitting down, normal-looking women, having conversations with each other and an expert about these topics, and just looking comfortable talking and having their questions answered. And again, whatever way we can make it sort of okay to talk about in a non-judgmental, non-creepy, non-embarrassing type of way.
You know, for just slightly switching gears, you see the forefront of new innovation in women's, health, whether it's technology or whether it's science or testing, or what do you think women should know is happening or on the forefront in terms of their health and how physicians want to approach it and what they expect from their patients?
There's research being done on female medications, sort of like a Viagra or Cialis. I think women need to be careful. The desire to help women, I think, is great, but I also think it's got a financial incentive. I feel it's a double-edged sword. On the one hand, I'm thrilled that people are trying to find ways of helping women. I don't particularly think there's going to be a pill that's going to, at least not yet, that's going to make a huge difference. And I think we have to be careful that we don't go too far the other direction, that we say to women, here, just take this pill and go have sex. I have a problem with that. I think women need to be empowered to be in control of their own sexual health, their own physical health, their own emotional health. And not every woman's going to be the same. And so I have mixed feelings about a pill. There's some things coming down the pike in terms of plastic surgery, genital plastic surgery. There's been a move that somehow women's genitals need to look a certain way. And there are surgeons that are performing surgeries to make, labia look better. I have real strong feelings about that. On the other hand, if there is some sort of surgery that a woman wants that would actually make her function better or make her feel better or help her, I think that's a good thing too. So we have to be careful in women's health that as people become more interested in helping women, it's a good thing. But I also think we have to be careful that women aren't taken advantage of and offered things that may be harmful or cause more stigma, more shame. Women's vaginas and labia aren't supposed to look a certain way. Everybody's looks different, and there's no one way they're supposed to look. So that all of a sudden everybody's looking and going, oh, mine doesn't look like the picture. And seriously, young girls are going and having genital surgery, and it's awful.
Well, it's just another example of body shaming in a sense, or, it's not body positivity. And I'd say you're at your healthiest when you think you look pretty awesome.
And it's related to everything we've been talking about, that women's bodies, as we give birth, as we age, as we go through menopause, our bodies change. And that's normal. And that's not ugly. That's not defective. We don't need to fix that. We need to sort of go, well, isn't that cool? I'm a really healthy, good-looking 57-year-old, and be proud of that, and not feel like there's something shaming about our bodies that we have to fix. And women not that we have to reproduce, but that's a normal part of a female cycle, whether you have children or not. There's a reproductive cycle, and that starts at a certain age and stops at a certain age, and our body will change throughout that period, and that's pretty cool.
Well, this has been just a fun and engaging and insightful conversation, Dr. Lucy, so thank you, first of all. We usually like to end our podcasts with asking for one piece of advice that you would give to our listeners, and they are women of all ages, new moms, women in perimenopause, which I'm in perimenopause, I'm in my 40s, and women in their 50s and 60s. What would be your piece of advice you'd like to leave with listeners today?
The most important piece of advice, it's twofold. It's allow yourself to ask, to ask the questions. Because if you don't ask, you may carry something around with you for a long time that actually you could be helped with, and that be empowered to ask and to take ownership of your own body and your own life, and really expect that healthcare providers or whoever it is you're turning to, their job is to help you, and that you need to ask. And the other piece of advice I have is, and this is something, it's a work in progress for me as well, but to really embrace the stage of life you're in at the moment. I'm not 20 anymore, but I am the best 57-year-old, I can be, and to take real pride in that, and sort of the body shaming thing, to really honor yourself. Honor yourself for being a woman, because I think being a woman, I wouldn't trade for anything. And honor your body, and honor that you have a voice, that you can ask for the help you need, and you can expect to receive the help, and expect to receive the help with respect and kindness and empathy, that you shouldn't be shamed or shouldn't be made to feel embarrassed or less than because you asked. And if you are shamed or embarrassed, go find somebody else to ask.
That's great. Well, thank you for sharing your insights and for having such an honest conversation with us today. It's just really refreshing when you can have this kind of conversation and be comfortable about it. And so I hope this kind of brings that level of comfort to everyone who hears this. So thanks again, Dr. Lucy.
Thanks for listening to the G-Spot. We welcome your feedback at geneve.com. That's GENNEVE.com. You can follow us on Facebook, where you will see more on show notes. And subscribe to us on iTunes, and you'll never miss an episode. The G-Spot is produced by Shannon Perry. Theme music by Smitty. And from all of us at Geneve, think happy, healthy vaginas.